don't have a problem. And doctor will say, okay, you have no problem, you're snoring, you don't feel unrefreshed, let's just leave it. But this could be an OSA patient who has severe sleep apnea. I've seen people with severe OSA where they're choking 80 times an hour, but they feel fresh as a daisy in the morning. 80 times an hour choking is a walking heart attack or stroke waiting to happen. Just because they feel fine doesn't mean they are fine, which is why if anyone's snoring or feeling having any signs of choking or snoring, even if they feel fine, they should do some sort of screening and sleep assessment